Hey guys, this is Jeff from Mend, Colorado, and today I'll be discussing kind of a common question that we get in the clinic when people ask about why did this happen? Why did these symptoms return? Why did my knee pain return with running? And an easy example here would be to think about this square. And the square would represent your capacity for activity. That would include your age, past medical history like maybe knee arthritis or an old ACL surgery, but your square would represent what you can tolerate. And then inside of your square are all the activities that you enjoy. It might be running, it might be playing with the kids, it could be work, it could be yard work or housework. But as long as your activities and the volume that you produce them in stays inside of the square, you're going to be asymptomatic. You're not going to have these flare-ups that are commonly occurring. But what tends to happen is that you take a runner who's used to running 1 to 2 miles per day, and that runner wants to run a 5-mile run on the weekend. And as he runs that 5 miles, he exceeds his capacity, or the tissue's capacity for activity. And you're gonna get that short-term flare-up of maybe 2 to 3 days of inflammation and pain. And there's a lot of things we can do to bring that patient back inside their square and make them asymptomatic. Things like dry needling or manual therapy or massage. But there's very few things we can do to improve that patient's capacity except for strength training. That's really the number one thing that's out there in the research that's gonna reduce your injury risk by 1/2 to 2/3. Is really working on strength training to expand your square. And if we can expand your square and make you more resilient for all the activities you enjoy, it gives you more wiggle room. You've got more wiggle room on the weekends to ski a full day versus half a day, to ski the double blacks versus the blues. You have just more resilience in your tissues to accommodate these different activities. So number one way you're gonna move from the inside square to the outside square is with strength training. About 2 to 3 days a week with the major muscle groups. It's going to make your tissues more resilient, it's going to reduce your injury risk, and really keep you out of the PT clinic. At the end of our newsletter, we've got multiple options for strengthening for both the upper body and lower body, for both beginners and advanced exercisers that you'll find at the bottom of the newsletter. But it's been a great 2018. Thank you so much for your support. Our patients remain our #1 referral source. We couldn't do it without you. But if you have any more questions, please let us know. Thank you.